Shoulder arthritis is when the cartilage surfaces are no longer smooth or congruous. That white shiny cartilage is replaced by exposed bone, and you can imagine that would cause a lot of pain. Here you're going to start through a whole litany of conservative treatment, over-the-counter pain medications, anti-inflammatories, sometimes topical rubs, going to a physical therapist, which in the shoulder is very important to have them rehabilitate whatever muscle you have left, and then get either plain x-rays or advanced imaging, such as an MRI. If you're told you have arthritis and the shoulder is too painful to move, you might be told you need to have a shoulder replacement. The shoulder replacement is often done through what's called a deltopectoral incision. If I can use my shoulder as a model, it's an incision in the front of the shoulder in what's called this deltopectoral interval. That allows us to go in between muscles and expose the shoulder joint with minimal muscle damage. And then the shoulder joint is replaced. Let me show you with a model what a shoulder replacement looks like. The ball of the humerus is now replaced with a prosthesis, which usually goes down into a stem into the bone, and the surface of the glenoid or the socket is replaced by this plastic piece, which then when put together allows the shoulder to move fairly freely. Now you might ask, how is my shoulder going to stay in place? Very good question. And this is where rehabilitation and the condition of your muscles play an important role. So you have what's called the rotator cuff that really surround the shoulder muscle that need to be in good shape for this joint to work. Otherwise, you'll have a very unstable or floppy joint or a joint that won't work. What if you present to the office with a rotator cuff that's completely shredded or incompetent, or you just cannot rehabilitate it? In the past, this was a major problem. No good solution was offered. Now, you might have heard of what is called a reverse shoulder replacement. And oftentimes that brings about a very quizzical look on my patients' faces. What is a reverse shoulder replacement? So if you can hold on to this image where the way we were made is the ball stays at the end of the humerus and the socket is at the end of the glenoid, a reverse shoulder is exactly the opposite. This is a reverse shoulder replacement. So now the socket is at the end of the humerus and the ball is now attached to the end of the glenoid. And you might say, how does that work? It's actually math makes a big difference. It's the subtle changes in the geometry that's going to make this joint work. So I had mentioned one of the common reasons we do this is because your rotator cuff is no longer working. What this does is it subtly changes the offset or the distance from the center of this humerus. Because with this ball being here, you're moving the center of rotation outwards, and now the deltoid muscle plays an important role. So you don't have good rotator cuff muscles. The deltoid muscle will now act as the rotator cuff to raise and forward flex that shoulder, giving fairly normal, not completely normal function, but significant relief of pain. So this is something that needs to be considered if you have a very arthritic or painful shoulder and the rotator cuff muscle is just either torn, incompetent, or just does not work and cannot be rehabilitated. In terms of expectation of range of motion after shoulder replacement, if you have an anatomic shoulder replacement, you can expect near complete range of motion in terms of raising your arm, flexing it, turning it inwards, and reaching behind your back. With a reverse shoulder replacement, you should expect significant relief from pain, but what we call full functional range of motion. That means you might not be able to raise your arm fully, but you can reach all the things you want to that are probably at eye level or slightly higher. You should be able to reach across your chest, but you might not be able to reach fully behind your back. So there are some accommodations that need to be made, but it does allow a lot of freedom, a lot of return to functional activity, and most importantly, freedom from pain.